Elbow flexion is the ability to bring your palm or the bottom side of your forearm towards your shoulder. And a lot of people can lose mobility in this based off of any sort of injury, lack of just exposing their body to that over years, or any sort of surgery. And if you don't have full flexibility, that is something we want to gain back for a happy, healthy elbow. And so to do that, you're going to need a wall to leverage yourself against. Now, whether or not you need full range of motion or you just need to build strength at your end range depends on your goals. So the first thing I'm going to go through is the stretch, and then we'll go through the pails and rails. You don't have to do all of those things. You can break them up and only do the stretch depending on your training session, or only do the pails rails depending on what your body needs. So for this exercise, we are going to get up against the wall, and you're going to have your whole forearm and hand up against the wall flat. Then from there, you're going to leverage yourself, kind of pushing your body weight in to the wall to get your bicep in front of your shoulder as close to your forearm as possible. Now, if you have really large biceps, this might be a little bit more hard or more difficult, but what we're looking for, if you need to stretch, is a stretching sensation on the back side of the elbow. You should have no pinching in the front. If you do, we don't push into that. If you don't feel a stretch as you get into this, you probably are not getting into your full end range of motion, or you probably just don't need to stretch. But once you're in the stretch position and you can feel what you need to, you would hold that for the amount of time necessary. If you're starting, it's going to be 30 to 60 seconds, all the way up towards that 60-second mark, but progressing towards 2 minutes as you are working up to the goal time. Then if you have done your stretch and you're doing pails rails after, we're going to go through that. So pails is going to be thinking about trying to extend your elbow, pushing the back side of your forearm and hand into the wall, ramping that intensity up over 10 to 15 seconds and holding at the desired amount of intensity for 10 to 15 seconds. Now, as you're doing this, you should feel your triceps working and maybe some of your shoulder stabilizers, but really what we're looking for is the back side of your elbow and arm here. And once that's done, you're going to ramp it down and relax. The rails contraction is next, and that is going to be trying to pull your bicep and shoulder into your forearm more, and trying to, at the same time, lift your entire backside of your forearm off the wall towards your shoulder. So that's going to look like this. You're not seeing much because it's a rails contraction, which means there's an isometric contraction and not a lot of movements happening there, but you should feel like your bicep is working really hard. It might cramp. What we don't want to see when we're doing this is a lot of wrist movement. Trying to get your forearm closer to your shoulder by using your biceps is not the same as trying to use your wrist muscles. Those should not be helping you. We really want to isolate the muscle group and the tissues that we're after. So you're going to ramp that intensity up to the desired amount over 10 to 15 seconds and hold that for 10 to 15 seconds. And then you would ramp it down, and that would be your rails contraction. From there, you might be done depending on your training session, or you might have another round, but that would be one round of your pails rails with your elbow. When we are doing that, make sure again, we don't have any pinching or sensations that are painful in the inside of the elbow. We don't want to push into that. Cramping in your bicep is something that is really common and means we have a little bit of a strength deficit. We can push into that a little bit, but we don't want to go into a full-blown cramp. So usually we want to keep the intensity just below that. And over time, as you repeat these, that should go away, which should be a sign that you're building strength. So make sure you're consistent with these. Don't push in to anything that you're not supposed to. And over time, you should feel like your mobility and strength are progressing and you are on the road to a happier, healthier elbow.